Welcome everyone to our NURS 321 group project therapeutic video. Before we begin, we would like to acknowledge we are on Treaty 6 territory and the homeland of the Métis. We pay our respects to the First Nations and Métis ancestors of this province and reaffirm our relationship with one another as we foster safe, productive, and respectful encounters in all places. This video was created for the purpose of implementing our communication skills and therapy frameworks in a simulated environment. Communication and counseling skills are essential in nursing practice as they form the foundation of therapeutic relationships. In Wright and Leahy's Nurses and Families, A Guide to Family Assessment and Intervention, Shajani and Snell emphasize that it is the nurse's responsibility to facilitate change through collaboration. The effectiveness of this collaboration depends on respectful and effective communication, which allows nurses to understand each person's strengths, beliefs, and needs. Proper use of these skills can allow nurses to identify sources of stress, support individuals, explore emotions, assess dynamics, and create goals. More often than not, as nurses, we are the first contact for people when it comes to mental support due to factors such as low income and marginalization. Being the first contact, it is important that we are knowledgeable in counseling and know multiple communication skills that we can integrate into our care. We would like to provide a trigger warning as this video will discuss sensitive topics such as domestic abuse and unhealthy relationships. For the next few minutes, we will see a young couple with a labor and delivery nurse for their postpartum checkup. Isabel Danger is a 27-year-old new mom who recently gave birth to her first child, and she's with her 30-year-old husband, Jake Danger. There are serious issues and concerns in their relationship as Jake has displayed escalating abusive behavior, both publicly and behind closed doors. We will see later on Isabel is considering leaving her husband due to her current situation. During this session, one of the therapies that the nurse will be using is person-centered therapy, also known as PCT. PCT focuses on the client-therapist relationship with the belief that people are inherently good and are capable of understanding themselves and solving their own problems. It centers around being genuine, having unconditional positive regard, and being empathetic with the overall goal of increasing the person's self-awareness. Our reason for choosing PCT is that it helps empower our patient who may feel powerless against their abusive husband. It also allows the patient to disclose as much information they want as they are the leader of the session. In addition to PCT, the nurse will also be using trauma-informed care, TIC. This is a holistic approach to trauma that focuses on changing the narrative from what is wrong with you to what has happened to you. It has 4 key principles: realizing that trauma affects everyone, recognizing the signs of trauma, responding to trauma, and resisting re-traumatization. Being an approach that is focused on addressing trauma, we chose TIC as one of our theories, as it is highly relevant to our patient who has a history of domestic abuse and trauma. Not only does it acknowledge her trauma, also avoids retriggering past experiences. Along with PCT and TIC, the nurse will be integrating the IV and IV framework to help guide the session, while also using multiple communication skills that will be highlighted throughout. Let's see how this discussion with the nurse goes.
Good to see you always have something to complain about, even while in the hospital.
I just gave birth. What do you expect from me?
I expect you to not complain about everything. Like everything.
I didn't see you push out a baby.
And I don't see you stop complaining.
Hi, my name is Angela. I'm a labor and delivery nurse here. I'm just here to talk about transition to home life as we plan to discharge you. Does that sound okay?
Yep.
Yeah. Okay, and just to confirm, you guys are the Dangers?
Who else would it be? Like, you saw it on the chart, did you not? Clearly we're the Dangers.
Yeah, I just always like to confirm, make sure I'm talking to the right people. I'm gonna have a seat if that's okay and just have a little discussion with you guys. So I just want to remind you that this whole conversation is confidential, so anything you guys share with me or any questions you ask just stays between us in this room, and I won't share them with anyone else. The only time I ever have to break confidentiality is if you or someone immediate to you is in danger. Does that sound okay?
Yeah.
Do you have any questions about that?
I don't think so.
Okay, sounds good. So, yeah, how has the transition to parenthood been for you two?
Well, it's kind of been an emotional and physical roller coaster here.
No, it's been a complete train wreck, in all honesty. Like, she's always complaining about something. She's on my case about everything. It's just terrible time.
Yeah, well, it's a big transition. It can be overwhelming for everyone involved. So that's normal, and I'm just here to try and make that transition a little bit easier. So, yeah, you're going to be discharged soon. Do you have any concerns or questions about home life?
Okay, I'm sorry. What is concern that is of yours? We just had the child, and we will do with it. We'll take it home, and that's where our relationship ends. Thank you.
Okay, well, yeah, I'm just trying to make it as smooth of a transition as possible for everyone involved. Did you have any specific concerns or questions? Well, he's very cute. What did you guys decide to name him?
His name's JJ.
It's Jake Jr. actually. He's named after me. Remember?
Oh, well, that's really nice. He's very cute. I can see the resemblance. He looks just like you, Dad. Yeah, so do you have
You know what? I'm getting a call. Somebody that's a little bit more important. Finish this up, do whatever. I'll be in the truck. Yeah. Find me later.
Sorry about that. You can just be a real jerk sometimes.
That's okay. You don't need to apologize. It's a hard transition for everyone. Do you want to tell me a little bit more about your home life?
I'm just a little bit stressed about being at home with the baby.
And why is that? Do you want to elaborate a little bit more?
Well, just I've never really done this before, and I'm not really sure how much of a big help Jake will be.
Yeah, and why do you think that is? Or do you want to tell me a little bit more about Jake's support?
Sorry, it's just a little warm in here.
That's okay. Do you want to take off your sweater?
Yeah. Sorry, JJ.
Oh, wow, that looks like quite the bruise there. Does it hurt?
No, I'm okay.
Do you want an ice pack?
No, I'm fine.
Okay, well, you let me know if you'd like an ice pack.
Yeah. I ran into the side table yesterday. I'm okay.
Well, I'm clumsy too, I get it. So do you want to tell me a little bit more about your home life and the transition and the support you have?
Well, it's just a little complicated. Well, Jake, never mind.
I just want to remind you that you can tell me as much and as little as you want, and this is a safe space, and I won't tell anyone else what you're telling me. It's all confidential.
No, I've already said too much. To be honest, Jake just has a short temper.
Do you want to tell me a little bit more about what you mean by that and what happens when he loses his temper?
He just seems to get upset over the smallest things that I do. Like I can't do anything right in his eyes. I cook every single meal for him. I clean up the house. I pick up everything. I do all the laundry, everything. And he just gets so mad at me. Like, I'm cooking food. I try to make what I think he would like. I try to make it, and he gets mad and thinks that it's too spicy or it's not flavorful enough. Just nothing's right.
Well, I'm sorry. I could see how that could be very emotionally taxing on you. Do you have any other support systems in place?
No, not really. My family, they're all pretty far away and kind of lost contact with them.
How about any friends? Do you have any close friends that could help you out?
No, I lost a lot of my friends in my relationship with Jake. Jake says I don't really need anybody else and I just need him. So
Yeah, I could see how that could be very isolating for you. Although having a good relationship with Jake can help, it can also be hard not to have other supports in your life and other people to help you out.
I don't feel very strong right now.
Well, you're definitely very strong, and even being able to talk about this shows me your inner strength, so thank you for opening up.
Thanks. I didn't think anyone saw what was going on. I just feel really overwhelmed at times. I don't know what to do right now.
Well, that's okay. Now we can work on a plan together to get you more support. Does that sound alright?
Yeah, that makes me feel like I'm not so alone. Thanks. I know that Jake doesn't treat me so well. Now that my little boy's around, I just want better for him.
Yeah, I'm glad that I can be a support for you. I'm sorry that you haven't been feeling that Jake's supporting you in the ways you need, but I'm here to work with you to make a plan that benefits you and your new baby.
I don't want my son to be treated the same way that I have.
That's understandable, and thank you for being so open and honest. It takes a lot of courage to go through what you're going through. Do you want to tell me a little bit more?
He's always had just kind of a short temper, but it wasn't this bad when I fell in love with him. I just feel like I don't recognize him anymore. This isn't really the man I once knew.
Yeah, that must be frustrating. You said earlier that you want to do better for your son. Do you know what that looks like, or do you have any ideas?
Honestly, I think I need to be separate from him for a little bit so he can change. I can't be around him when he's like this, and I don't want my son to be around him. Just not till he gets some help.
Yeah. And what does being separate look like for you?
I think living in a different house with limited contact.
Yeah, and when do you want to start doing this?
Honestly, as soon as possible. I don't think I can handle it anymore.
When you say you don't think you can handle it anymore, do you feel safe around him?
Sometimes, but not all the time.
I just want to make sure that you and your son are safe. So I have some resources in mind that might be of help to you. Are you interested in them?
Yeah, that would be great.
Here in this pamphlet here, there's a couple different resources that may help you.
Thank you. I'll take any of the help I can get right now. I think I currently have some money saved up, probably for like a week or so. So JJ and I can get out and maybe stay in a hotel.
Yeah.
Or something out a little bit.
That sounds like a good short-term goal. If you need any help that requires immediate assistance or you have any questions, you can always reach out to the Family Services Saskatoon. It's a 24-hour crisis line that can help with your situation. And the phone number is 306-933-6200, but it's also in your pamphlet there if you ever need to use it.
Thank you, that would be great.
Yeah, so that's a good short-term goal, but to maybe help you with some more long-term goals, I'm going to get you in touch with a social worker if that's okay.
Yeah, that is. Thank you.
Okay, and are you comfortable with me just kind of explaining your situation with them to keep them in the loop?
That's fine with me.
Okay. So yeah, it seems like we have a good short-term goal right now. So I just want to clarify what we talked about today. So you're experiencing some troubles with your partner, your husband, and you're feeling maybe not the safest around him. So you're looking to get in a hotel for a first week and then connect with a social worker to help you with some more long-term goals to be separate from him. Is that correct?
Yeah, that's correct. Yeah, I think that's my plan for now. I'm gonna pack some of my things up, and in the next couple days try to get out of there. He's going on a trip with his friends, so I could probably go when he's going.
Oh, well that sounds like a good plan. Just before we end our meeting, I just want to ask if you have any other concerns or questions right now.
No, I think I'm okay. You helped me a lot today.
Well, I'm glad to hear that. I'm going to connect you with that social worker we talked about, and I hope nothing but the best for you and your little one as you go forward.
Thank you. I appreciate that so much.
Overall, through this group counseling video, we intended to show how PCT and TIC can be used to help someone who is suffering from domestic violence. With PCT specifically, we learned how to better build rapport and trust with patients, focusing on the client-therapist relationship. This allows for an environment where we can empower the client and help them become more aware of their own problems. And with TIC, we learned how to better address trauma experienced by patients through trying not to re-trigger past trauma. This helps with building rapport with the patient so that we can help them process their trauma and move forward. And along with counseling theories, we implemented multiple communication skills such as active listening, attending behaviors, silence, empathizing, paraphrasing, and summarizing. This theme is relevant to our practice as future nurses due to the prevalence of domestic violence in the world. It is estimated that about 1 in 3 women have been subjected to domestic violence. Although we aren't counselors, as nurses, we play an important role in being a bridge or first contact for helping patients access resources. Thank you all for listening.
Very cute. What's his name?
His name's JJ.
Oh, cute.
No, it's Jake Jr. for me. He's named after me.
Oh, well, that's nice. Yeah, he looks just like you. I can see the resemblance.
Yeah, sure.